Hi everybody, my name is Annette Swearengin and I am part of Group 1. For this assignment, I analyzed the first paper from our reading list, which is pazopanib versus sunitinib in metastatic renal cell carcinoma. So for additional context, renal cell carcinoma is a particular type of kidney cancer. The article was published in the New England Journal of Medicine in 2013 by Maltzer and colleagues. So how I arrived to my classification was sort of easy in the beginning because the authors actually use the exact language that I'm going to talk about in their paper, so it helped me confirm my determination. But I did classify this study as a randomized control trial, which is considered the gold standard of medical research. Now, even though part of the classification was there were still a couple of things that made the classification a bit challenging for me. The first is the open label design that really threw me off initially, because in a typical randomized controlled trial, no one knows which treatment that they're getting. The patient nor the doctor knows, but in this study, everybody knew what they were getting. And so I had to dig a little bit deeper into the trial, and I realized that blinding was simply not possible here because the two drugs are completely different. They're different in how they're dosed, and then ultimately what side effects that they do cause. So it's still a valid randomized controlled trial, just without blinding. Now, second was understanding the non-inferiority part, because most drug trials will ask, is this new drug better than what's already exists, what's on the market? But this trial was asking something a little bit different. So we can think of it this way. The second drug, or the more established drug, sunitinib, it already had the job as a vetted, valid, working, established treatment. So the first drug, pazopanib, was the new candidate, and the question here was not, is it better than sunitinib? It's just, can it do the job equally as well? So once all of that clicked, my classification further fell into place. Now, as far as difference of opinion, we did have editors for our group to review our papers, and I didn't feel that there were any differences of opinions on my paper from my group members on this particular study. But I am genuinely curious if anyone else have reviewed this paper and if they see things differently. So